Um, Thank you. Thank you for attending this meeting on the Lusaka Agenda Accountability Framework. We are very happy to convene so many CSOs today with us. But before we start, I would just want to highlight that we have interpretation service, English, French, French, English. And if you look at the bottom of the screen, bottom right, there is an interpretation icon. So when you click on it, there is English, French, and you can choose the language of your preference, yeah? You know that the Lusaka Agenda reflects the long-term evolution of global health initiatives, which is a timely discussion given the challenges of the global health financing landscape. So we really look forward to your input, feedback on this accountability framework so that it is inclusive and represents the voices of our communities. Yeah. I hope you have received the agenda for this afternoon. And first on the line, I would like now to give the floor to Dr. Tajuddin Raji, Deputy Director General of Africa CDC, to say a few words representing Africa CDC. Over to you, Dr. Raj. Thank you.
Pasika, it's Dr. Landry Tsage, the Director of the Center for Primary Healthcare, who is going to deliver the remarks on behalf of Dr. Raji Tajuddin. Can I proceed?
Please, Dr. Landry, I think Pasika has connection issues.
Oh, she could not hear me.
Yes, please proceed, Dr.
Okay,
Landry.
thank you. So, good afternoon. I think we may be on a different time zone. So, good morning, good afternoon, depending on where you are taking this call from. My name is Dr. Landry Domotsage. I'm the director for the Center for Primary Healthcare at Africa CDC headquarters here in Addis Ababa. It's my privilege to deliver these remarks on behalf of the Deputy Director General Acting for Africa CDC, Dr. Raji Tajuddin, who was planning to be with us this afternoon, but he's still held in a meeting at the AU Commission. So it's my distinguished honor to welcome our partners from the civil society from all over the continent and abroad, working on the interest of the 1.8 billion of people of Africa. I'm very happy to see that we have attendance close to 100 today. This is a clear illustration of the interest of the civil society and your commitment to the Lusaka agenda, your commitment to the well-being and the health security of Africa. So let me recognize my sister who is representing the Directorate of Health and Humanitarian Affairs at the AU Commission, Dr. Sheila, representing Professor Julio. Let me also recognize my sister, Ms. Susan Moshashe, who is the Executive Director of the African Constituency Bureau, and to congratulate her team for this great mobilization. I think they are all behind the huge momentum that we see this afternoon. Let me recognize Ms. Rosemary Mburu, Executive Director of WACI Health, who also through her team's commitment has made this meeting today possible. So dear colleagues, dear participants, ladies and gentlemen, it's a really timely consultation today on the Lusaka agenda, which follows a consultation that we all heard about 2 weeks ago with the government participants or government representative from our member state. We were privileged to have a consultation at the margin of the AU Summit. As you remember, the AU Summit this year happened between the 13th and the 15th. So we had a consultation with member states around the 11th of February. And today's consultation provides an opportunity to listen to the perspective of the civil society organization representatives on this important topic of the Lusaka agenda. The Lusaka agenda, which articulates the conclusions of a process which over the past, I think between 2023 and 2024, accumulated in Lusaka into the 5 strategic shifts that collectively we endorse to define the future of global health initiative. So, ladies and gentlemen, the meeting today happens in a very unique context. You are all aware of the evolving global health financing landscape and recent decisions from countries to reduce their overseas development assistance. You are aware that the Lusaka agenda is a global agenda, yes, but it's more importantly an African agenda. It calls for a paradigm shift. It calls for moving towards more reliance on domestic resources. It calls for improving accountability, fostering strategic partnerships, and aligning with Africa's long-term health goals. The Lusaka Agenda 5 strategic shifts aim to advance alignment with one national plan, one budget, one monitoring framework for domestically financed health services and public health functions. This shift, and we are going to go into details into this meeting. I'm sure most of you are very well aware of those shifts, but they all aim to make a stronger contribution to primary health care by effectively strengthening integrated systems for health, strengthening joint approaches for achieving equity in health outcomes, achieving strategic and operational coherence, and coordinating approaches to health product, research and development, and more importantly, regional manufacturing to address market and policy failures in global health. Ladies and gentlemen, as you may recall, the African Union head of state at the February 2024 AU Summit requested Africa CDC, the AU African Union Commission, and other AU organs to develop and implement an accountability framework for the Lusaka agenda in Africa. This accountability framework complements the Lusaka agenda roadmap, which was developed jointly with member states in June 2024 with the support of Africa CDC, the AU Commission, WHO, UNICEF, UNAIDS, ACB, and other partners from the civil society primarily. So to enable the coordination of the mandate given to Africa CDC, AU, and other AU Commission and other organs, a coordination structure was necessary. On December 3rd, 2024, Africa CDC established a continental secretariat for the Lusaka agenda. The secretariat serves as a central coordinating body, ensuring that there is policy coherence, technical assistance, and the integration of Lusaka agenda priorities into AU and national health strategies. Ladies and gentlemen, today's gathering aims to ensure that the Lusaka agenda is well understood and socialized within our partners of the civil society organizations, and that your insight and feedback will inform the finalization of the draft monitoring and accountability framework for the Lusaka agenda. Additionally, we will discuss with you the next steps towards the validation of the Lusaka agenda accountability framework. I therefore look forward to the deliberations of today's meeting, and I hope that we will have an inclusive accountability framework that fosters the key principles of respectful, result-oriented partnership and shared accountability, all of which are central to Africa CDC's vision for a new public health order in Africa. So on behalf of the Acting Deputy Director General of Africa CDC, Dr. Raji Tajuddin, I thank you and I wish you a successful meeting today. Back to you, moderator.
Thank you very much, Dr. Landry, for those introductory remarks. Next, we would like to hear from Dr. Sheila. Dr. Sheila, you have the floor.
Good afternoon, everyone. Thank you so much for this opportunity. I am just relaying greetings for the professor. He has been unable to attend. He just came into the office today. He was on leave after the summit. And then there's an ongoing meeting, which should have ended by now, but it's still ongoing. So just greetings from the African Union Commission. And I think as we've heard from Dr. Landry, we are supporting this work. We've been part of it from the beginning, and we're happy to hear your thoughts and provide this briefing together. I also just wanted to highlight that the question that will rise is, we have been working with some of you on the AU Roadmap 2030 and beyond, which was adopted by the heads of state this February. And so what you will notice is that the work is aligned because we've been working on it as a team. So you realize that what is in the AU Roadmap and what is in the Lusaka agenda is well aligned. And what we're trying to do with the accountability framework is to ensure that it speaks to the AU roadmap and then to the global objective of Lusaka agenda. So with that, let me just say thank you and looking forward to interacting and providing any clarifications that we may be required.
Thank you, Dr. Sheila. We thank the AUC for supporting this process. I would now like to give the floor to Ms. Suzanne Mochache, who's the Executive Director of the Africa Constituency Bureau. Over to you, Ms. Mochache.
Thank you very much. As the African Constituency Bureau for the Global Fund, we are really honored to support the development of the monitoring and accountability framework for the Lusaka agenda. As the representatives or the organization that supports the representatives of Eastern Southern Africa and Western Central African constituencies at the Global Fund, the ACB plays a unique role in ensuring that the global health discussions that are held align with our African priorities. Therefore, our engagement in this process this afternoon is driven by a deep commitment to making the Lusaka agenda a collectively owned process and initiative by all the actors of health in Africa. And so we are most delighted that we are having this dialogue with the CSOs this afternoon. I want to also just recognize that for decades as a continent, we have been beneficiaries for over 70% of global health initiative funding and channeled through several organizations, including the Global Fund that we affiliate with. And what the Lusaka agenda does is that it really signals a major shift in how these organizations have been engaging with our countries. And we are looking at moving away from externally driven interventions to having greater harmonization, greater country-led approaches aligned to our country priorities, and efficiencies that are gained through the integration of programs away from the verticalization of programs that we currently see. And this shift is now more critical, more than ever, because of the changing global health financing landscape. The donor funding is declining, as we know. The US has made such a huge signal. We don't need to reiterate that, but it tells us that it is very urgent for us to ensure that there is efficiency in the application of the resources coming, and that we also double up our efforts on domestic financing for our health systems. I also want to just acknowledge that a key pillar to this transformation is this monitoring and accountability framework, which will ensure that these shifts are translated into measurable outcomes. And it provides us the structure to be able to monitor progress. And who better to have this afternoon than the CSOs, who are inherently a part of the accountability. In fact, the key accountability actor within the different countries and even at the continental level. So as we move forward, we want to reiterate our commitment as ACB in our mission to bridge continental and global discussions that advocate for better coordination, sustainable approaches to global health financing, and championing Africa's leadership in shaping its health future. Thank you very much.
Thank you very much, Ms. Mochache. I would like now to give the floor to Ms. Rosemary Mburu, Executive Director of Waki Health. Over to you.
Yeah, thank you so much. Good evening, good morning. All protocols observed. It's a pleasure to be here and to have this civil society consultation with the African Union, Africa CDC, Africa Constituency Bureau, and a huge representation from communities and civil society. So we've come a long journey in this agenda, going back to the future of global health segment or phase, which was the research phase that then led to the 5 key shifts and led to a document that we now call the Lusaka Agenda, with the principles that we have been following very closely as civil society. We learned a number of lessons given the future of global health institutions process from our communities and civil society points of view. There were concerns, there were voices, saying that we want to see better engagement and involvement of communities and civil society. And as we move towards the Lusaka Agenda, that's one of the areas where I think by us being here this afternoon, the opportunity for us to put in our voice in terms of the accountability, in terms of the measurement. And so I see it as a great progress in terms of bringing communities and civil society voices here, while acknowledging that communities and civil society are not homogeneous. So we also acknowledge that there are many colleagues who are not here. There are many groups of communities and sub-communities who are not here. And I think it is our responsibility, all of us as stakeholders, to make sure that we are not leaving anyone behind and we bring everyone along. Having said that, I also wanted to reflect and say that the agenda, the Lusaka Agenda, is an agenda of alignment, is an agenda of coordination. And what we want to see is better coordination, better alignment at the country level with all actors within the global health space. But as communities and civil society, we are also saying that even if we had all the alignment that is needed and we had all the coordination that is needed, but we didn't remember some of the principles that have actually helped us to see the gains and the health outcomes that we have seen over the last decades, then we'll still not be making sufficient progress. And that is why there is a paper, there's a document that communities and civil society have put together, documenting our priorities on how we would like to see the Lusaka Agenda implementation going. But key among those things is to ensure that we are remembering to approach it from a human rights perspective. We are remembering the gender dynamics in the implementation process of our programs. We are remembering the concept of leaving no one behind. And all these principles actually are very well embraced within the principles of the Lusaka Agenda. And so our focus on the accountability is to make sure that we are mindful of the how. As we are mindful of the what, we are also mindful of how and what got us here in the first place. And therefore, we look forward to continuing to be a partner. And this accountability process is very important for us, as we are very keen to ensure that it's not just the alignment and coordination, but it actually contributes to better health outcomes. So we look forward to continuing being part of the journey, continuing to bring more community voices, more civil society voices, and to really contribute towards better health outcomes in our region. I thank you very much, and we look forward to the deliberations this afternoon. Back to you, Director of Program.
Thank you very much, Rosemary, for the opening remarks. I also would like to thank our panelists for giving us very warm remarks. We will now go to the second session of this call, whereby we'll hear more about the accountability framework itself and also the scorecard. So now I would like to invite Dr. Justin Maidia, who is the head of Planning, Reporting, and Accountability Division at Africa CDC. He will giving us an overview of the accountability framework and also the scorecard as well. So, Dr. Justin, you have the floor. Thank you very much.
Thank you very much, moderator and esteemed colleagues, ladies and gentlemen, all protocols observed. So my work here will be easy. I know the CSO has been involved in this whole process since then. So part of the big overview of that, I'll skip some of those, but there are some that I'll be taking you through, and then the rest we can go dive deep to the indicators and also the accountability framework itself. And then after that, I think we can open up for discussion and you're hearing your inputs based on what has been put so far. So my name is Justin Maeda. I'm the head of Planning, Reporting, and Accountability within the Africa CDC. I'll take you through all these few slides that will just set the tone for the discussion that follows. So I'll be touching like 4 areas, which is the quick overview, and which I'll rush through this plus, and then touch on the overview, the accountability framework, and the scorecard itself, the scorecard indicators, and then the proposed coordination structure for the implementation and some of the framework on those scorecard itself. So let me start here with the on an open note that we all have been observing the shifting sands in terms of the global health financing over the few years, and also of more important in this year where we see a continuing decline of external health financing, particularly those key donors who have been financing the global health initiatives and other initiatives within the continent and the whole world for the past years. But we also see how most of the countries have been facing some challenges, especially in ability to meet the Abuja Declaration of 15% for of their finance of their budget going to the health. And this has been led due to there's a lot of competing priorities and the stagnant GDPs that in the past few decades or past few years, we've seen them going back and forth with some of the complexities and issues like the pandemic, the COVID-19 pandemic that took some of this progress that was made in the development of the economic infrastructures and economic sources going back for some few years. And this has really affected and brought about the scramble for the few finances that they have within the countries, and every country will be struggling, and the health department and health in particular will be competing with other sectors to ensure that it's well funded for safeguarding the health of those citizens who are working there. So it's a challenge and an opportunity at the same time. And it calls for action to ensure how we strengthen our domestic resources mobilization so that we increase some domestic financing to cover the gap that we're seeing with these changes that we've seen, but also enhancing accountability and transparency to ensure that the few resources that are allocated to support health are also utilized with efficiency so that there is more, we can retain the same health progress or stride that we're making in health, or even increase the health stride with the limited resources that has been there. But also, how do we forge some strategic partnership that align our long-term national health goals and the strategies with any investment that comes into this nation? So these are critical issues that we need to think around loudly, and how do we support all these member states and coming collectively to ensure that this is working in progress. So I know all of you the whole background of this and how did it came through, but also because you've been part of this process, or not spending much on the 5 strategic shifts that are there, but also to just bring into light so that you can also be able to recall them as we go into the deep dive of the discussion, which is on the primary healthcare through health system strengthening, the catalytic role of sustainable domestically financed health systems, but also the issues of strengthening joint approaches to achieving equity in health outcomes, and the 4th, which is on achieving strategic and operational coherence, and the 5th one is about coordination, more of the coordinating approaches to products of the research and development, as well as the regional manufacturing, so that we can be sustained as a continent, and also as the global space as well. And we note that Lusaka agenda is not an African agenda. It's a global agenda that Africa, as the major beneficiaries of this, as colleagues have said, we have been benefiting almost 70% of most of these GHIs. It is more important to us, and we need to really discuss it that way. So there are several timelines that have been met from the launch of the UHC Day, December in 2023. A lot of things has happened when this Lusaka agenda was introduced. We have had it endorsed by the AU Head of State and Government in February 2024. We had the Addis Ababa Consultation workshop. I know the CSO were part of this, where we came up with the Lusaka Agenda Implementation Roadmap. We have endorsement of the implementation roadmap by the Minister of Health during the regional committee of the Ministers of Health in Brazzaville in 2024 August. But also, what is next now is to see how we come up with an accountability framework, take it through processes of validation and operationalize it, so that we can go deep now to the ground to ensure that this move from just a concept to something that is implemented. And that decision from the head of state and government was critical, where it also assigned all the AUC and Africa CDC to really work on this, and also ensure that we keep on reporting back to the assembly in time to time. And for this to happen, we need to ensure that we have an accountability mechanism, and this accountability framework is part of that accountability mechanism that also will be accompanied by the scorecard full of those indicators. So the approach to the accountability framework is having the tetrad of this of the implementation of the Lusaka agenda, where we have the regional organizations, the likes of the Africa Union, the WHO, and others who have been working and supporting health. We have the governments on the other side, these are the national governments who are the actual implementer of the Lusaka agenda at the national level. We have the global health initiatives who have been funding, and also we treat them as the strategic partners who are really bringing in the equation the financing complementing part of all the initiatives that are being supported with this, and the more of health strengthening within the continent, and also the civil society organization who You have a critical role, especially in ensuring that we have an equitable access and delivering of the programs, the programmatic activities within the member state, and in a way that it touches each and every citizens of this continent. So this is critical. And at the middle there is where we need to come up with that accountability mechanism that ensures coordination and collaborations for the implementation of the Lusaka agenda. So the proposed structure of the accountability framework is to have on top there where we have the AU policy organs that we need to be reporting back as they have requested and after they have endorsed the concept, which also represent our member state in the continental level in the pool force. And below that is the coordination mechanism that need to be under the Africa Union, umbrella with the Africa CDC, Africa Union Commission, especially the Department of Health and Humanitarian and Social Development. And down there, down to the national levels where you have the Africa Union member states who will be the implementers. And then we also have the CSOs and organizations, the ACB and others, and all the other contributors in the UN organizations, and other philanthropies and private sector that we're all bringing together to support all this mechanism. So the engagement today is critical to ensure that we also bring you into speed as we are doing the consultative process to ensure that we feed into the structure and we hear your feedback as we finalize the structure of the coordination mechanism. As Africa CDC, given the mandate that we have and its formation and position in the continent as an autonomous health institution, it was critical that they also serve as secretariat because Africa CDC was also formed as a coordinating entity for health within the continent to ensure that we also support partnership, collaboration, leadership in health, and aligning different health strategies and provide a strategic direction that will ensure that we promote health and public health practices within the continent. And this is supported by different articles that is stated in the statute of the Africa CDC as displayed there. I'm not going to go in one by one, but it's quite critical also to know that Africa CDC as a public health agency of the public health institution of the Union is quite critical. So the Lusaka, as Sheila had earlier said, it's a Lusaka agenda is the formulation of its M&E and accountability framework is really aligned to the AU 2030 roadmap that you all have participated. And it takes through the consultative process that is being called by the Africa CDC and Africa Union Commission, also have involved the ACB and other organizations that are also have a stake in the health within the continent, including the WHO, UNICEF, etc., to ensure that we also leverage on the AU 2030 roadmap to really support the financial sustainability of the continent and integrate the Lusaka agenda metrics into the one AU M&E and accountability framework that will be presented and also will be using the same to report to the heads of state and governments. As the journey so far in the preparation of the draft accountability framework and also the indicator that are forming the scorecard, which in totality form this accountability mechanism. We had the draft that was also developed earlier. We sent it to the different GHIs. We discussed with the global health initiatives, the regional organizations, and now we also have done it already with the member states with the initial consultation, which will still have a validation process that will follow. But also we now take it now. This is the time that we're bringing also to the CSO so that we can get a forum that we discuss exclusively with the CSOs to get some of those. So before I open up for discussion, let me take you through the first set of indicators, which is the critical one that will be reporting to the organization and to the AU policy organs. With the discussion and the consultation that we had with the member state, it was collectively agreed that we need to have two sets of indicators. The first set of indicators are the indicators that are measuring the implementation of the Lusaka agenda within the continent. The second set of indicators is those that will be measuring the outcomes of the implementation of the Lusaka agenda itself. So this one is measuring on the implementation, and the other will measure the outcome of the implementation, of which this will be the outcome of those health programs that are being financed by the Lusaka agenda, which is not part of the presentation today. So for today we'll only be discussing the implementation, the indicator that are measuring the implementation of the Lusaka agenda, of which we have 10 that were proposed, and these are the same that were shared with member state. And also to say that we had also received and we continue to receive some of the additional feedback on those, which what we're presenting here is exactly what was also presented to the member state for your also initial reflection, and also we'll collect any additional inputs into this so that we formulate a revised indicator as well as a revised structure for the accountability framework itself. So the first two indicators, the government, it's on the government expenditure in health. The first one measures the government health expenditure as percentage of the GDP, which I think this looks on how much nation's economy is being invested in health sector. But the second part is measuring the percentage of total health expenditure from the total domestic resources. Recall that the initial one, the first indicator, measure everything in totality, including those that we get from the external support. But the second one is also specifically looking into the domestic resources that have been mobilized and how much of this goes to health, which is quite critical for that. Now, the second two set of the indicators, this was also measures on the expenditure, but the first one is government health expenditures I think that was a repeated slide. This is a percentage of GHI governance mechanism at country level that is integrated with a wider sectoral coordination structure, which this looks on improved coordination and how much of this GHI governance mechanism is already integrated into the wider sectoral coordination. The second part of that as an indicator is about the GHI support to national health workforce that is channeled through the national pay scale of mechanism. So this is it's mostly looking on sustainability, especially for the workforce that is being funded by the GHIs. And all of this included from the highest level, the national level, to the lowest workforce, which is the community health workers. And we know for some of you who have worked with the community level, we had most of this parallel investment that goes to the different workforce, and which are repetitive and probably in sustainability may not really speak to the sustainability part of that. The third set of indicator, which we also have two here, is the percentage of GHIs that is involved in single harmonized application process. This is also to kind of like increase efficiency and reduce burden to the countries as they're working on applying for some of these GHIs, application that they do and repeat every year. So, and this way we reduce administrative workload for countries and minimize the duplication, because some of those you find that there's a duplicate of submission to the same GHIs, to different GHI of the same processes in the same program. So for alignment, it's quite critical to harmonize the application processes, not the application submission, but the application processes to different GHI. So this also has to be very clear. But also the percentage of GHI funding for health dispersed to government out of total commitment. So this is also showing the predictability in terms of GHI funding. The fourth set of this is issues related to the governance and the oversight of these GHIs. And one of the critical ones is to look how much of these GHIs or funding for health are audited through the domestic auditing procedure so that they can be able to know every pen that has been invested and government be able to understand this, how is it being utilized within the country. But also percentage of GHI investment that is aligned to one national health sector plan. This is to ensure that there's ownership and alignment and also some effectiveness in the way that these resources are being deployed within the countries, etc. So those are the 10 indicators that have been mentioned here, and I will leave open up for discussion before we go. So I would love to bring it back to you, the moderator, for the discussion. Thank you.
Thank you very much, Dr. Justin, for the wonderful presentation. So I know colleagues are very much interested to ask questions. So maybe we will do 5 questions, then I will proceed to the next session. Then from there, overall, we'll have a Q&A session later. So I see Jonathan Mbuna and Joseph Wato. So we'll start with Jonathan and Joseph Wato. Jonathan, go ahead. Unmute and go ahead. Jonathan, unmute, please. Okay, until Jonathan comes, Joseph, maybe you may proceed. Then we'll come back to Jonathan.
Okay, thank you. So thank you for the great presentations that we just had and the introduction by the CDC Deputy Director and so on. We are very happy with the Lusaka agenda and what it takes, what it's showing, the accountability, the one budget, the one framework and so on. That's very interesting anyway. But maybe my first point would be, I know as we are developing the Lusaka agenda, we always say, yeah, civil society is implicated, is taking part of the Lusaka agenda. But I'm very sorry to see that I don't see enough civil society from Central Africa being more involved in that framework or developing the document, because I know there are, African French country, they are not a lot invested. If I take Central Africa and sometimes West Africa, they just come when policies have already been developed and so on, and they don't really take part on it. I think maybe we can find a way to really introduce them into the process so that they can participate well. And but I saw also in the framework, I saw somewhere they put civil society organization and they cited ACB. But I don't think the African Constituency Bureau can be considered as a civil society organization, because we know how the ACB is being composed. It's mostly with government members. But if we want to make sure that we have civil society, let it be the civil society, not considering that ACB is a civil society, considered as a civil society. But as I appreciate the Lusaka agenda, it's good, but we are having a huge challenge with the Abuja Declaration.
Mr.
How
Joseph,
does
kindly make it brief?
Abuja Declaration? I just want to make sure, how does it complement? How does the Lusaka complement the Abuja Declaration? Because I think if the head of state doesn't meet the commitment of 15% and commit now on Lusaka agenda, how will it complement the Lusaka? Because we don't want something where we have external funding coming to finance our domestic health. We want domestic resources being there to finance our health, not a basket.
Thank you very much, Mr. Joseph. Jonathan, can you speak now? Colleagues, kindly let's put our questions as brief as possible. Jonathan? Okay. Go ahead, please. Okay, Jonathan, we can still hear you. Dose, can you hear us? Please proceed with your question. You have 1 minute, Dose. Dose, you're muted.
Dose?
Yes, please proceed. You have 1 minute.
Bon, je peux parler?
Oui, allez-y.
Okay, thank you. I'm Joseph from Togo, and I want to know if the civil society you are implicating will be financed. Two, for the criteria of accountability, I want to know if you have
maybe don't say if you can speak in French
a percent by GDP for the health. Have you a level of percent? Bon, je peux changer, parler en français.
Let me speak in French. Do you have a percentage? Because the national income are not the same in all the countries. The income, the GDP is not the same for the different countries. You have a percentage that we can actually verify with our government to see whether they have reached this percentage during the year, for example. That's the money that goes into health. And thank you.
Thank you very much, Mr. Doze. Mr. Waiswa, you have the floor. Waiswa, kindly unmute. Waiswa? Okay. Mr. Monde?
I think I'm on now, right?
Okay, Waiswa, please proceed.
All right. Apologies for the glitch. So just wanted to raise a few points here on the accountability framework. My computer is acting in a way that is not letting me. Okay. So there's a little bit of a discrepancy between what we see in the framework and also the scorecard. The framework includes 6 different stakeholders, but it is missing or it does not have bilateral donors as as stakeholders. And so the question there is, what happens, because we've just seen what happens when a bilateral donor, pulls out or freezes funding. And so it would be great to have them also included because of that. And then we see that also in the scorecard, they are indicators for government and also JHIs. But there is nothing on IFIs and bilateral donors and UN agencies. So, making sure that these two different documents are aligning on these bilateral donors and other agencies like the UN agencies. On the indicators, there is an issue around what we think when we talk about alignment. I think when we talk about alignment, we're talking about one plan, one budget, one M&E. But we don't have an indicator on the one plan, on the one budget, on the one M&E. So, for example, a one plan indicator would be, let's say, the percentage of ODA that is aligned with domestic budget cycles. And for the budget, one budget would be maybe the percentage of ODA that is reported on the budget, and maybe have an indicator on the M&E that is about the percentage of ODA that is monitored through national routine M&E systems. And so there's some of the few comments, and maybe if you can clarify a little bit on that. I think also want to support the point raised around the SCB being referred to as civil society. A little bit of clarification on that. Yeah, thank you.
Thank you very much, Waiswa. We'll take from Humphrey Onday, and we'll give it back to our panelists. And we'll have more time for Q&A later. Humphrey, you have the floor.
Thank you, moderator. This is Humphrey from Zambia, where we are discussing the Lusaka agenda, the Executive Director, Civil Society Health Partnership. Moderator, this meeting is very, very critical and very crucial for us as civil society here in Zambia. But what we are seeing is that the civil society agenda is not really looked at in terms of coordination aspect. So the coordination is not done in an effective manner. I don't know, with the guidance from our leadership up there, what mode of coordination are we going to use? Because here in Zambia, we have two lead CSOs, the one that represents the faith-based, and ourselves who are representing the CSOs and NGOs in health. So as we talk about these consultation processes and coordination, we would want to urge our leaders out there that let it be civil society themselves that are engaged in this programming. We must be involved. At times, we should not just let it to the governments alone to implement these activities. Even as we talk about universal health coverage, civil society plays a very key role. So, Chair, Moderator, I submit, even as we support the Lusaka agenda, but what we need is more engagement in the implementation aspect and monitoring the Lusaka agenda, that let civil society organizations be part and parcel of this process. I submit, Chair. Thank you.
Thank you very much, Humphrey. Dr. Justin, you have the floor to address the remarks, the questions, sorry.
Sure, thank you so much. So I'll take some, but I'll also invite Susan, Landry, or Sheila in case they want to jump in, because this is a wide discussion. So from Joseph, I think the issue of involvement of CSOs, I think this has to be also agreed within the CSO internal organization, how you work on that, and probably also Fitsum, you can also respond to that. I'll build, but I think it's critical to show that. But also, I think we can engage with through the Africa Union Commission and other mechanisms that are in there, like the ECOSOC and others who are dealing with civil society, to see how they enhance the coordination among the CSOs for a maximum input. We really need your input. We really need your support to ensure that this is implemented as well and effective. The issue of ACB, I think that's an oversight. But also we will also be able to see how we change that, and this is a draft, and I think the final draft will make sure that it's that ACB is well presented there. Is somebody who has a mic?
Les extra. Donc, vous dites c'est quoi ça exactement? Extra. La production totale.
Check,
Donc,
maybe.
ici, ça peut être
Okay.
en
So I
tonnes
think
ou
it's
kilos.
done. So
Et une fois que vous avez mis le produit,
the
vous
issue,
pouvez ajouter à
how
si vous
Abuja
avez pu,
declaration, maybe I'll
David, can you
that.
assist us? I think there is a background
si
noise.
vous avez,
Someone is unmuted. Kindly.
No problem. No problem. I think it's with the translators. There was a mix in the translations.
Okay, translators, I think there seems to be some mix. We're hearing your interpretation in the main.
Voilà les données que vous allez mettre ici.
Okay,
Donc, cela signifie qu'une fois que
so with the
le
ACB,
l'OPR,
with the Abuja Declaration, and how does it, from Joseph as well, how does it complement the Abuja Declaration? I think the Lusaka agenda is looking around the health finance and now more on the implementation of such decision like the Abuja Declaration. We know few countries have really attained that, and most of countries are very far from attaining the Abuja Declaration of the 15% of the annual budget that is being dedicated to healthcare. So the Lusaka agenda is also bringing in ensuring that we attain the Abuja Declaration. So it is all integrated into the Lusaka agenda for the implementation. Now to Doze, I think the first question I didn't hear very well, but he was also asking about percentage for what is the percentage that we need to communicate with the countries to ensure that as we're implementing that there should be a target percentage. And I think we are using the same for the Lusaka agenda, which is the 15% of the national budget that is dedicated to healthcare, and how do we able to attain that. But beyond that, I think there's also part of those percentage of those resources that are coming from domestic, the domestic funding that are also dedicated to health, and which I think if you see on the indicators, we have mentioned that, and the target is 15 to see how many countries are really attaining the 15%. The first question, I think when he was speaking in English, we couldn't get it better, but if all is well, maybe you can drop it on the chat and I can look at it and be able to respond to that. Waisua, I think he has talked about the framework and the 6 different stakeholders, and that it is missing the bilateral donors. I think when we're talking of the GHIs, we're also thinking around any external support. Maybe there could be a way to put that in a better way so that it looks on all the external support that also comes to funding the resources, so that it's well all coordinated in a one approach. But I think that's the meaning. But also we'll see how we capture that in a way that it's also all inclusive, so that we don't leave anyone who is contributed to health financing outside this discussion as well. The scorecard as well, as you say it covers all the government and GHI, and there's no indicator to cover the GHI, the bilateral donors, the UN and the regional organization and CSOs. So we assume that the regional, from the framework, the accountability framework, it touches on the roles and responsibilities, who is working on what. and what is the role of the regional organization, who are mainly to support the coordination and also more of an enabler and providing an enabling environment that brings clarity and coordination around the space. But if you have any possible indicator that you feel that can also be able to monitor these, please share with us. We'll also be more than happy to accommodate them and discuss them in the subsequent engagement. The issues of alignment into one plan and one budget, I think I had displayed that indicator. If you do recall, we're also looking around the percentage of there was an indicator that is talking about the percent of GHI that investment aligned to one national health sector plan. And I think that to just minimize the numbers of indicators, especially the one that we are reporting at the head of state levels, we thought that could be a representative of all the issues related to One Health, One Budget, and One Health. But any other indicators can be taken, and also we may need to consider them, but also put them at the technical level, because we still have some low-level indicator that can be reported at technical levels, but keep the other one, the 10, that will be reporting to the head of state at a very high level, so that we don't kill the appetite of them following up on this. So the fewer, the better. The many, the advantage to us to be able to monitor each and every aspect of the implementation. So we'll collect as many as possible, but also segregate those that we can report at the high level, at the policy organs of the union, and that level, and also keep the others that we can engage and can be used to engage the technical teams during the implementation. But we'll love to hear from you, Waiswa, to get any proposals of a new indicator that need to be included. Please help us submit them, and we'll see, we'll accommodate them as we implement. Humphrey, you had talked about the same CSO agenda and the coordination aspect. So I'll also leave that to either the team who are coordinating the CSOs or my other colleagues to supplement that. I think I had responded on it earlier. Thank you. Over to you, moderator.
Thank you very much, Dr. Justin. Yes, there have been some questions also that were directed to civil society coordination, especially from Central Africa. So I think this is something we can also discuss internally, and definitely on our next subsequent CISPA calls, we will address this issue and have more civil society join us. But we have also civil societies from Central Africa who are actively participating in CISPA engagements, and also within the Lusaka agenda space as well. Ms. Susan, would you like to attempt some of the questions before we proceed? Okay, then I think
I don't. Thank you very much. I think let me just acknowledge the question around ACB and just say yes very categorically that we are not a CSO, but you know, our orientation being in the Global Fund is that we leave no one behind. So we have also been very active to ensure that even as we work collectively under the leadership of both the AU and Africa CDC, that we also raise our voice to say that every other key stakeholder must be part of this process. And maybe that is why it inadvertently came out that way, but certainly we are not a CSO, and I'm sure that error will be corrected. Let me stop there for now.
Thank you very much, Ms. Suzanne. I know, colleagues, there are lots of questions that are coming on chat as well, and also
Yes.
Also participants online. Let's proceed to the next session, where we have Dr. Landry, who will be discussing about the accountability framework and the governance, and also further going to the Lusaka Agenda Indicator dictionary itself. So let's give Dr. Landry the floor, then hopefully we'll have more time for Q&As after his presentation. Dr. Landry, you have the floor.
Dear moderator, this is basically the continuation of the session that started with the Q&A on the presentation of Dr. Justin. So I believe we are already in the discussion segment. So let me take this opportunity to invite.
So maybe we can jointly co-moderate. Is that
Yeah,
okay?
exactly. Because I see a lot of hands. I think Tebika, Jonathan, Abula, they have their hands up. I don't know
So
whether
I also presented the two, I combined the two to give more time for
exactly.
the overview and also the Lusaka agenda so that we can get more time for the questions and discussion. So we have the two presentations were combined. And that's why I started with the overview of that and the Lusaka agenda framework, and then I went to the indicators. So I think we have more time. Maybe we can take two other sessions, including the one from the chat. If you'll be like, so over to you, Landry and colleagues.
Thank you very much. So Rosemary, let's give you the floor. Then I think we can proceed to Tabika, Abdullah, and also Okalo. Rosemary?
Yeah, thank you so much. It's maybe seeking clarity so we can be very sure where this particular item falls. And because Dr. Justin, as you were making the presentation, you did indicate that we have two sets of indicators. And the one we have unpacked right now is the one on the implementation of the Lusaka agenda. So I wondered where we would find the proposed indicators for equity. So the shift number 3, which looks at strengthening joint approaches for achieving equity in health outcomes, and really just thinking about how we can look at expanding and complementing the public sector or even the private sector to then also include community leadership, to include deploying coordinated and targeted programs to reach the farthest to reach. In some of the spaces, we also use language like vulnerable, and most at risk. And how do we ensure that we are supporting integrated services for unreached communities? So the question is, where are we placing the indicators for the equity, the shift on equity number 3? And then that can help us, because as civil society, we've unpacked, some of the critical things that we want to see as indicators. And I also want to, as we respond, that we have a colleague here in the chat who had asked a question in saying that it's important to, like, as we come here and we gather to think about an accountability framework, there's a concern that how are we developing an accountability framework for something that, civil society were not present in the planning. But I just wanted to clarify to colleagues to say that as civil society, we've really actually been asking for this accountability framework. And what this opportunity gives us here right now is to speak to the indicators that we would like to see measured at the country level. So from a measuring and accountability framework, this is our opportunity to say, given the 5 shifts, what would we like to see? What would we like to monitor? What indicators would we like to see? What indicators from what has been presented are missing and are important for us to voice? So I just wanted to reflect that and to say the equity one is actually missing, or maybe you can unpack where we can find that. Thank you.
Thank you, Rosemary. Can we have Dr. Landry, would you like to respond to that? And we open for another.
No, I think we need to, let's take more questions and then we can have a round of response. Over.
Tahibika Shan.
Yes.
Please go ahead.
Thank you so much, and thank you for the great presentations. So Tabika Shanmugarasa from the Community Health Impact Coalition. I've put my question in the Q&A, and it is around what Rosemary just mentioned, the equity component. given that the third pillar is focusing on expanding the reach and reaching the most vulnerable, it seems like an indicator on health workers, particularly community health workers, is very crucial. So my question, and you've already responded, Dr. Landry, that it would be important to have one on workforce. How do we go about in suggesting an indicator for this that could be included? So what is the process? Thank you.
Thank you very much, Tahika. Ogalo, you have the floor, please.
All right, thank you. Thank you very much for the good presentation. My name is Ogalo, the Executive Chairperson for the Confraternity of Patients Kenya. Confraternity of Patients Kenya, otherwise known as COFPAC. Of course, a major interest is on issues patient safety, quality of care, and of course, patient satisfaction. This is, I must admit that this is it's a very interesting and a very important discussion that as a people in the African continent should be able to, embrace and even so be able to influence the other parts of the world. From the area that we come from, on the perspective of civil society organizations, I was just trying to look at the document, and I was wondering, because I understand that in order to be able to hold someone accountable, we must first be able to understand the tools that are useful in being able to, hold institutions accountable, and even so being able to enlist the consequences, and to it also matters of, the commitments. And also feeling that there's a need to highlight some of the motivations. We need to highlight some of the rewards, because in order to be able to monitor and even control, it is important to enlist the rewards to it. Otherwise, this is a very good process. So those are some of the questions and even points to take note. Thank you.
Thank you very much, Ogalo. Maziko, you have 1 minute.
Thank you so much, Fitzu, but also the panelists, Rosemary and Doc. Mine, I think, looking at, I want to congratulate you for coming up with the Lusaka Agenda Accountability Framework. Mine, I think, is on patient satisfaction. In most cases, I think most of our health strategic plans, we have patient satisfaction as one of the initiative or indicator for the civil society to monitor health services. So I don't know in the framework on how we can be reporting, because we have our reporting framework in country, and how can we be reporting to the broader framework, the Lusaka Agenda framework, on the other accountability initiative within our own strategies in country, so that we have unified and aligned feedback on what is going in different countries as well. Thank you.
Thank you very much, Maziko. Tebik, I think is that a new hand or? Okay. Can we hear from Abdullah? Or has Abdullah spoken before? Waiswa, is that a new hand or? Waiswa?
Yeah. And just speaking to the point that was raised earlier in terms of alignment of the indicators with the key shifts themselves, including on equity, I didn't feel like there was something, any indicators on the product development, R&D, and manufacturing, and just wondering if that's reflected somewhere that I didn't see. Thanks. That's it.
Thank you, Waiswa. Dr. Landry, can I give you the floor now? Thank you.
Yeah, no, thank you. My role here is to facilitate the discussion. I don't have the ambition to answer to all your pertinent questions, but let me start by saying, when it comes to monitoring indicator or monitoring the 5 shifts, we have to make some choices. We have to make some choices, but we have to be able to articulate through the indicators how we will hold ourselves accountable. When I say ourselves, I'm talking about the stakeholders that are listed in the accountability framework. So let me start with the last question. Waisan, I think, Waiswa, you are touching on an important development, which is the one on local manufacturing. We are still discussing with the team working on this agenda because there's a clear target set by the head of state, which is to have close to 60% of vaccines utilized in Africa, procured through manufacturers in Africa by the year 2040. So that's a clear commitment. So we are following up with them to be able to track the same indicator that they'll be able to monitor at their level. Because local manufacturing, as you know, is a very, very, very big and complex space, but we need to have an indicator to reflect that shift on moving forward. I want to comment the point made by Maziko. I think we need to discuss that a bit more. And I want to hear from the CSO. How do you see the current accountability framework reflecting your role at country level? Because that's where action will happen. That's where the change should happen. I think Masiko was insisting on currently the CSO is playing a key role on being the sounding board, or being the voice of the community in terms of implementing some of the commitments around health. How are we going to ensure that the implementation of the Lusaka Gender Accountability Framework is part of the mandate or the day-to-day work of CSOs moving forward? I think I want to hear from other colleagues, CSO in this call, because this is a great and important outcome from the meeting today. And I'm going to invite Justin, maybe to come in here on the indicator related to the workforce. I think on the proposed 10 indicators, there is one that talks about resources allocated to support workforce. It may be indicator number 7 or number 6, but I think the question now is that indicator enough to reflect the focus on equity? Or do we need to break that indicator to allow a differentiation between the investment that we do on the community health workforce, that we bring access to services to the last mile, as opposed to indicator that we support investment to the broader workforce? I think that's an important point for the equity discussion that Justin, I would like you to reflect on. And this is a difficult question that Waiswa raised earlier around how do we differentiate how do we capture the alignment? We attempted to capture it, and I think Dr. Justin also tried to answer that question very well. Alignment is definitely going to be a process, but what we'd want to ensure is that the GHI broadly somehow move towards reducing duplication, because the member states are very clear. We do not want, as member state, to continue to submit, to spend almost 60% of our time in a year to submit applications for funding opportunities to various GHI. How can we have one single window to reduce duplication in the submission? And let me just reflect again on the point made on the how do we ensure that as we measure the allocation to the health sector, we are able to adjust for the population. I think we need to reflect on that. The allocation, the health expenditure per capita is somehow the most robust way to capture that information. I think, Dr. Justin, you may want to come back on that to check whether we are reflecting the per capita expenditure, the per capita allocation in the current set of indicators. So those are my initial reflections, and let's open to Dr. Justin and Susan, as well as Rosemary, for their reflection and contribution. Dr. Justin?
Thank you very much, Landry. And let me start with the question from Rosemary in terms of equity. So I think if you look around the strategic shift number 3, it's also talking about it strengthen the joint approaches, which I think the issues like the joint plan, the joint implementation of support into the healthcare workers, the health workforce through the national mechanism brings that joint approaches so that there's minimal duplicate in terms of the resources that are being deployed to support the workforce. And the equity now also comes as an outcome to the joint approaches. How do we bring about equity, etc.? So, and which I think within the second set of indicators that are measuring the outcome of what the Lusaka agenda brings on board has to reflect that. I think Dr. Landry will suggest that those second sets of indicators that will also be monitored, we may need to share, maybe think around if we can work on that and share as well to get full inputs. And I think this will also respond to several other questions that has been mentioned here, issues of patient satisfactions, and many others that probably, if we have a mechanism to measure them, because also when you put any indicator, you also need to understand on how you're going to collect those information and be able to update those as well. I think the indicator of manufacturing, Landry, this is a very valid point, and we may need to see how we bring that. We know that we are monitoring at the continental level, but as part of the Lusaka agenda, we may need to rethink around if we need to include that at this high level that we are looking on the implementation, or think a way to include that because it's quite huge, and I think the target is big, and probably we may need to see how to bring it there. I think responded to several, including the one for Tebila in terms of expanding the reach. The issue of equity can go to the technical set of indicators that we may not need to do. As I say, we would love to capture as many indicators as possible here, but the more you go beyond 10, even 10 is a big number, into the indicator that will be reported to the head of state and governments, then you lose it. So it's either to kind of like trade off to see what can we drop here and what can we add into the 10 indicator that we're trying to do for the high level scorecard, balanced scorecard that will be reported to the head of state and government as we move forward. I think the issue of that was also raised on Dominique in the chat. Rosemary has spoken to that, but also to just add into that I know the Lusaka agenda is a global agenda. It's not an African agenda. We are just adopting to implement within the continent. And this draft that we're doing was just initially developed by the Secretariat, shared by the different GHIs, the member state, and now the CSOs. So you have the whole chance to contribute to it, send your comments. Also, after this engagement, we're going to open up to allow you to send additional comments that we can all include it here. As we said, we need as many inputs as possible. We need ownership. We need also maximum contribution from each and every one of you, and probably more coordinated approach to ensure that we have more input from all the CSOs and from all the regions in Africa. So utilizing different coordination mechanism among the CSOs that you already have established will be critical, and will be relying on all of you here to assist us on how do we reach more CSOs to provide input into the document so that it can be all inclusive and represent the thoughts of many as we move forward. What did I miss? I think the rest have been covered by Landry. Which one? Looking.
Yeah, the point on the per capita allocation and the per
Yeah,
capita.
sure. I think the per capita allocation is critical, and I'm not sure this could also be part of those that we need to trade off. Let's see which one we can drop off, and probably this could be covering some of those. So per capita expenditure can be also well, but also thinking around when you approach health in totality, you're also thinking around any visit to healthcare facility should be minimized if prevention is well taken care of. So maybe within that you minimize the visit based on ill health, and you increase the visit for issues related to screening and checkups, and also a good health seeking behavior practices. So maybe we need to think around how do we really treat that per capita expenditure. I know with the quality increase, also per capita expenditure may increase, but also should not be mistaken by an increase in healthcare visit due to ill health. So let's see how we can, that may need maybe a deeper discussion to see how do we treat that indicator in a way that it will really measure what matters, Dr. Landry. Maybe we can take off this discussion, but we put it as one of the possible indicators that we can monitor, but need to be discussed and engage the different technical experts on this area so that it really ensures that it doesn't mislead the process. Thank you.
If I may, Justin, Dr. Londre, this is Susan. If I can also just chip in and say that I think you have captured generally, the challenge that we have right now in terms of the trade-offs of what to have as an indicator and what to leave out. And in terms of way forward, I think the CSOs also have now been well socialized. You see the challenge of the competing interest of indicators. And I think it will be useful to also just get your own perspectives now that you have been socialized. And hopefully you will caucus as CSOs to help us also think about what you consider top priority and what maybe can be put together and help the team to progress this work. Because like Justin said, I think anything beyond 10 as a start will be a very tall order if we want to succeed in getting this feedback from countries. So perhaps that can be one of the takeaways through you, Dr. Londre, to get solid input on this difficult question of trade-offs on the indicator. Thank you.
Oh, thank you so much, Susan. I think the choice of the indicators is definitely going to be done through a consensus process. We completed this exercise with member state representatives. We are currently having the same exercise with civil society organization representatives. And one of the next steps is to have a moment where we collectively take stock of what is coming out from these consultations and then agree on what should be the minimum set of indicators that would reflect how Africa or our member states are moving forward towards the 5 shifts that are required to accelerate progress towards universal health coverage and to ensure absolutely equity and to strengthen primary health care. I think this is a challenge. This is at the same time the ambition of that the head of state took in February 2024 when they endorsed the Lusaka agenda as an African agenda. Let me check first how good we are doing with time. The principal moderator, Fitson?
Yeah, I think we have like 19 minutes, so I think we can take the remaining 14 minutes for Q&A, then the remaining 5 will do the closing remarks. So I think we have good We have good 14 minutes.
Yeah, I asked a question for Consultation. You remember my question? How do we see the role of the civil society at country level supporting the implementation of the Lusaka agenda? Can we have a last round of contribution from the almost 100 participants to that question? Over.
Okay, that will be great. Dear participants, kindly, you may raise your hands to give us your feedback on that. So, shall I start with Dose? Let's start with Chris. If you can respond to this question as well. Your hands has been raised for a while. Chris.
Thanks. I look at one of the roles the CSO could do. My name is Chris Owala. I work with Community Initiative Action Group Kenya. One of the roles the CSO can do is to help in generating citizen-driven data, because at times the indicators we use are far off the mark. But if the citizens are also supported, work together and generate the data, then the participatory engagement and the full ownership of the process will be embedded in the community. Two is that when you're looking at the health care, the health financing, the CSO could also help in domestic resource mobilization. Because if you look at the new model, the funding challenges that are happening, if you take away donor funding in most of the countries, then you realize the pledge is a shell of itself. So the CSOs will also help in domestic resource mobilization. And finally, is also to help in promoting accountability in the resources that goes to health care. Thank you.
Thank you very much, Chris. Doze, please, you have the floor.
Doze, isn't it? Oui, allô?
Please continue.
Oui, ok. Et ce que je voudrais ajouter, c'est que
mention
la redevabilité
is that accountability covers
au fin fond des communautés.
Up to the level of the community. This means that ourselves, we are at the continental level. But if we do not have a mechanism, well-planned mechanism, from the regional level, the sub-regional level, from the level of countries, the sub-country, sub-national, at the locality level, it won't work. And I think we should have a proper mechanism which can facilitate monitoring, also the collection of data, and also facilitate accountability. So the work that is done on the ground will be easy. Because what is happening in Togo, for example, in a far-flung place, you could be at the headquarters, but you can know what is happening in that far-flung place through the reports that they give you. So we can put in place mechanisms where we have a multi-actor mechanism. So I'm talking of a multi-actor mechanism. For example, you can work with the local government, which can be put in the committee, the civil society, the private sector, and maybe the faith-based organizations and other structures, like even the traditional leadership. And the information can come through all the committee, which is now going to help us through the different levels, up to the national level, up to the sub-regional level, and up to the regional level. And I think the Africa CDC will be there now to receive all the information that comes from the whole of Africa. Thank you.
Thank you very much, Doze. Ogalo, I see your hand is raised.
To proceed?
Please.
Okay, thank you. That was a very interesting question. This is Ogalo still from Kenya, Coff Park. In the future, in years back, CSOs were known as noisemakers. When you asked what exactly we the CSOs, civil society organizations should be able to do differently from what traditionally perceived as noisemakers. We want to transition to being part of making contribution, and of course contribution based on data-driven contribution, borrowing from what the speaker spoke first on data. Indeed, data really influences a lot, and of course it makes sense to policymakers. So as CSOs, then we will be contributing. We should be able to contribute, and we are contributing based on data-driven facts. Then something very important is also being able to liaison. We are the bridge between the people in the community, and the policymakers, and even the implementers. So ideally, instead of being left out during the construction of ideas and even agendas, it should be important now to integrate the CSOs in the moment of, and even in the process of, making matters or ideas, or coming up with agendas that affect the population. Then lastly, we had a conversation, I think 2 days ago, that is the CSOs, particularly dealing in the HIV care and treatment, the TB. And one thing we also noted is the fact and the need to have, shadow budgets. When the countries, as the governments are making the budget, it's also incumbent upon the CSOs to now, in consultation with other experts, because our community, we believe, a community, it is from the community that we draw even the experts. So we believe that we can also be part of, doing a shadow project, so that we are able to have a very concretized way of ensuring accountability. Thank you. This is Ogalo from Cove Park, Kenya. Thank you.
Thank you very much, Ogalo. We have Dominic.
Yeah, thank you. I already.
Dominic, please proceed. Yes, we can hear you.
You hear me now?
Yes.
Okay. So I sent a contribution in English, but I will speak in French now.
Okay.
Je voulais dire que je pense que ce que la société civile peut apporter
civil society
pays en ce qui concerne
that can give at the country level. We can our role in the Lusaka agenda, it depends on the role that we have in the different countries. So if in your country you are seen as an important actor by the government and you are involved in all the processes, I think there it's going to be easy. But if it's not the case, that in your country you are not seen like that, it's going to be difficult. Our participation in what we do at the regional level, it is okay, but the important places in the country, and it's important that at the country level, the ministries of health are sensitized and so that they know the importance of involving civil society in the health matters, and that they can work with them up to the grassroots level. It's the same thing with the international organizations that are in our countries, like the WHO. It's important to involve the non-government organizations in their work. And I think this aspect is very important because we have an experience where at the initiatives we have participated at the regional level, but when now we try to do it at the country level, the civil society organizations do not appear. They are not recognized at that level. That's what I wanted to give as my contribution.
Thank you very much, Dominic. Francis, you have 1 minute. Francis, kindly go ahead.
Yes, can you hear me very well? Can you hear me?
Yes, we do.
Okay. Thank you very much. So we thank Wachi Health and the partners on this call, and especially my brother, Landry, for this. And I like the question because I think one of the key things we forget is that the seventh unwritten element of the building blocks of the health system is actually around voice and social accountability. And that is very, very critical moving forward with the Lusaka agenda. And for me, a lot of the speakers have said a lot of things eloquently, and I probably won't repeat what they've said. But three things are very, very core for me. And these are the issues of how the CSOs can heavily participate on this, moving this agenda forward. One of them is around research. I come from an institution that is a research-oriented body. So we are very keen on working with other CSOs to conduct research and document best practice around and knowledge sharing to inform policy around the Lusaka agenda. That's very, very critical for us. And then, of course, the other side of it is the issue of capacity building. Is very key, especially when you're looking at Lusaka agenda is people focused, and the fact that it's also like I saw one of the posts there around the granular layer of implementation, having even community frontline workers, and all that. So building capacity around all those things to understand and track is very, very key for accountability mechanisms around it. So for me, I think those and advocacy, of course, has been said over and over, and because of these things are very key, because CSOs are more or less gatekeepers in terms of, or rather like ombudsmen of the system, in terms of making sure that the key stakeholders deliver on the actions that are expected of them. So I'm Francis, Director General, West African Institute of Public Health. Thank you very much.
Thank you very much, Francis. Waiswa, we are really out of time. I'll give you like 30 seconds.
Absolutely. So I just want to make one comment on the question around the role of CSOs at the country level. Based on observations, I was recently in Kigali, and we had a session on the Lusaka agenda, and it became very clear that people didn't even know what it was. So a big role of what we're going to do, or we civil society can do, is really to socialize, promote awareness of what this is, because it's going to have major impact on people's lives, and it's going to transform how we do health going forward. So it's really important that that role is noted and taken very seriously. Thank you.
Thank you very much, Waiswa. Dr. Landry, let me give you the floor to also give us a brief summary of the discussion so far. Then we'll proceed to the closing remarks. Thank you very much.
Thank you very much. Let me first check with my sister. Yes, I think Dr. Sheila is back. Dr. Sheila, I'm happy to have you back. Let me attempt to summarize what I captured through the discussion around the question of the role of the CSOs. I think the first message comes from the last one, which is the role of democratizing, socializing, creating ownership, and making the Lusaka agenda a community agenda and a civil society organization agenda. The second point, which is clearly what I was expecting, and I'm very happy that it came out clearly, is the CSO should be the voice of the voiceless. The CSO should be the voice of equity. The CSO should be the voice of translating the evidence into the policy dialogue. And that there are also important considerations that came from the discussion, is that for the CSO to play that role, member states, government, when they establish the national, or let's say the country level team or the country level mechanism for the implementation of the Lusaka agenda, the role of the CSO should be clearly articulated in that country level. And I really want to call on Susan and my colleague Rosemary to make sure that as we finalize the accountability framework, the segment of the role of the CSO should be very, should reflect the conversation we are having now, so that when a member state, they receive the document, they will understand what they have to do for the country level implementation of the Lusaka agenda to align with what we want to see from a continental perspective. I was also very happy to hear about the citizen-driven data. I think we need to maybe capture that clearly in the accountability framework, a country that is not able to leverage citizen-driven data collection, getting the perspective of the user, may be missing an important component of the equity with regard to access to services, because at the end of the day, it's going to be about the quality of primary health care. The last one, I was very interested to hear CSO playing a role on domestic resource mobilization. I wasn't expecting that. This is really great. So it now brings in the concern that member states are facing now around what are the new pockets of money. It's about the fiscal space, right? It's shrinking. But the question now is, how do we create new pocket of money to increase the allocation to the health sector? How are we going to ensure that if a country was allocating 7 or 10% of their domestic resources to the health sector, how are we going to ensure that that allocation increases with the reduced allocation from external donors? This is the biggest question that we want to address together. And what can be the role of civil society organization is somehow what I'm also capturing as an important contribution to the implementation of the Lusaka agenda. So let me stop here. I think this was a really good discussion. Mr. Fistum, main moderator, let me hand over back to you.
Thank you very much, Dr. Landry. Thank you very much, all our participants, for the wonderful session. I'm quite sure this is our first start. Definitely, we will be having follow-up conversations around this. There have been very good questions on the chat, which we will also summarize them in the meeting report and share with you once finalized. I would like to give the floor to Ms. Suzanne if you have any contribution or any feedback. Then from there, I'll give it to Rosemary for her closing remarks.
Yeah, mine is to really take this opportunity to thank Dr. Landry for the leadership he has offered this work and for being very open to make sure that we walk along with all the key stakeholders, including this meeting we are having today. Rosemary, I want to thank you for helping us with the mobilization of civil society. I always, as I've expressed before with you, I always believe that there's so much value that you bring to our work. And without fear of contradiction, you are dealing with CSOs is actually usually much more vibrant sometimes than when we are dealing with other actors who I will not name today, but I just want to say that we are confident that together we are going to have fully owned, collectively owned Lusaka Agenda Accountability Framework. I think we also recognize that these are just the beginning steps of a journey. And I think if we start strong, we will, with time, be able to evolve the framework to be much more comprehensive and assist with the progression of delivery of health services to our people in the continent. So with those few remarks, I want to thank you very much.
Thank you very much, Ms. Suzanne. Colleagues, before I hand it over to Rosemary for her closing remarks, we have shared the African Civil Society Platform for Health WhatsApp link. So kindly, you have it on the WhatsApp, on the chat. So kindly join so you can also get further updates. We also have your email, so definitely on the follow-up, I will make sure that we copy you in those conversations. Rosemary, let me give you over for your closing remarks. Thank you.
Yeah, thank you so much. Thank you, Fitsum. And my network is going down, so I'm off video for now. But I wanted to thank the partners at the African Union, Africa CDC, Africa Constituency Bureau, and all the civil society colleagues, communities and civil society who have continued to show the importance of communities and civil society voice when it comes to making sure that we are stakeholders in Africa's health response agenda. And we are very happy to contribute to this discussion. We've been really following up to say we are looking forward to this conversation since this process started. And so we are happy to hear that, it's open, tell us what indicators do you want? So this is the kind of tone that we are receiving from the partners, and Africa CDC being the one, the captain for the accountability framework. We truly are also committing to come to the table with our views, our perspectives, and what I think we will do going forward and from here is to also regroup to engage more with the accountability framework proposal or draft that has been presented. We take note that in the chat, there were many voices of civil society. Joseph Wato, we hear you about Central West Africa, Francophone, and I know our sister Olivia has also been leading on that, and it's important to connect communities and civil society at country level. We hear you, and we hear you very, very loud. I also wanted, for full disclosure to the civil society here, to say that Waki Health, together with the civil society engagement mechanism for UHC 2030, has been participating in the meetings of the core leads of the Lusaka agenda, WHO, AFRO, Africa CDC, and Africa Constituency Bureau. So I, together with CSEM and our colleague Cecilia Seno from Ghana, who has been representing civil society way back since the FGHI process, we've actually been participating in these conversations. And so I think the better we can coordinate ourselves as civil society, the better we can be able to present a united front, but not closing out any community group or subgroup or any civil society of either geography. Really is not closed. So very happy to hear reflections. We've been given a window. I think, Landry, you let us know within what time frame we can submit input to the accountability framework. We have presented some reflections here, but I think we can open up to maybe 2 weeks. You can guide us on that so we can ensure that we collect additional feedback and that it's consistent. But I also wanted to mention from our participation in the co-lead conversation, we are private to the fact that we have some countries in Africa which are champion countries on the Lusaka agenda front. And if you're from either of those countries, you have a really good opportunity because those countries are like front runners. They are running with the Lusaka agenda. And they are having those conversations. And I've put these countries in the chat. So if you're from Central African Republic, DRC, Ethiopia, Ghana, Malawi, Mozambique, those countries are providing leadership, are championing the Lusaka agenda. And what that means is that those countries will be moving forward the conversation and the implementation. And so if you're from those countries, it means that the bus in your country on the Lusaka agenda front is on ignition. It's starting, it has started. So kindly let us come together. We are happy to support you with updates, even to support you with country level webinars, virtual webinars to unpack the Lusaka agenda so that you can also connect and be able to engage with the government in terms of accountability and all that, so that we don't leave anyone behind. So with that, I thank you very much. And I see Landry, Dr. Landry is saying within the next 2 weeks. We appreciate that, Dr. Landry. And for civil society, kindly join the WhatsApp groups that have been mentioned there. We meet every 2 weeks as communities and civil society to discuss the Lusaka agenda. And actually the voices from the country level are missing. So we need all of us. We need all of us to come together. And at the country level, there is how we are organized. We are already organized as civil society. So use your structure at country level. Let us know how maybe we can support with the webinars, with unpacking, and so on and so forth. So I thank you very much. And we look forward to continuing engagement with all the partners. Thank you.
Thank you very much, Rosemary. Once again, thank you for our wonderful panelists. Thank you very much for our very wonderful participants. From us, Fasika and Fitsumu were your hosts, and we hope to see you soon with the follow-up conversation. Bye-bye for now.
Bye. Thank you.
Hi, thank you.
Bye.